This is the Nourished Brain Podcast, where we explore the art and science of nutrition for brain health and mental well-being. The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. I'm your host, Sarah Thompson-Fajera. Let's get started. Jennifer Haynes is a registered dietitian who specializes in the connection between nutrition and mental health. She helps dietitians and mental health professionals integrate evidence-based nutrition strategies into their work with a focus on improving mood, cognition, and overall well-being. Through her business, Mood Matters Dietetics, Jennifer offers education, consulting, and resources rooted in nutritional psychology. She's especially passionate about making science practical and accessible, whether that's in the clinic or on the plate. And Jennifer, here we are. So Jennifer, I'll share the background of how we got connected for this conversation that we're going to have today. So on LinkedIn, I saw recently that you, also a dietitian, really interested in all things mood and mental health, had started a journal club. And I know you've kind of focused on a couple different things, but one month you were taking a deep dive into omega-3 fatty acids.
Yes.
And I thought, oh my gosh, what better topic to kind of like restart this podcast with, because from what I'm seeing and from what we'll dive into today, there's a lot to know. Right?
There's a lot. There's a lot more nuance than I even knew before I read the particular article that we talked about in Journal Club.
Yes. Yeah. So, I guess start off telling us, how did you first become interested in the role of omega-3s in mental health?
I feel like more of a being interested in nutrition for mental health kind of leads you there, so to speak. So almost my interest in mental health nutrition kind of coincided. Like they're pretty closely interlinked. People talk about like the Mediterranean diet for mental health and stuff like that, and this idea of like just fish in general comes up, and that is not necessarily the same context of taking it like as a supplement or whatever. But it's just one of those things that we have pretty well-documented research on, like, that it is actually effective versus this one study on 10 people thinks that it might help, or you know what I mean? There's a lot more of a robust body or variety and body of evidence in the fish oil, kind of that particular nutrient. So it gives a lot of information. I talk a lot in Journal Club about like this idea of like a positive publication bias. So to me, there is so much research published about fish oil, and not about some other social media discussions about nutrition for mental health makes me feel like even more strongly that it is an effective, tool. I don't know if I explained that well, but hopefully that kind of sort of answered your question. Yeah.
And I mean, it really does stand out because so often we wish as dietitians that there was more to work with. And so we're just trying to make our best decisions. And so, given the amount of research that's been done around omega-3 fatty acids, let's understand it and let's use it.
Sure. Definitely. I wish we had more access to negative research results, because I feel like that's a huge piece of the information. Like, has that not been researched, or has it been researched and it doesn't work? And we don't know.
Oh my gosh, yeah. So true. Okay, so let's just set the stage here.
Okay.
Just talk about the basics. Of course, some who are listening, they might already know this, but review is a good thing, right? Just
right.
Make sure. So go ahead and just let's break down the differences. What are different types of omega-3 fatty acids?
Sure. So when we're talking about omega-3 fatty acids, there's three main ones that we talk about, right? So there's the alpha-linolenic acid. I always have to say that in my head before I say it out loud. And that is more of a plant-based, right? So that is the nuts, the seeds, the olives, the avocados, all of those things. And then there is the EPA and the DHA, and I'm not going to try to pronounce this for you. We're just in it, but those are the fish oil supplements, or the fish oil fats, right? And we
Okay.
can get those from fish. We can get those from algae oil supplements and stuff like that. Within that, as far as the omega-3 fatty acids go, the ALA, that alpha linolenic acid, that is the only essential fatty acid, right? That's the only one that we have to have in order to survive, right? If you remember back to like essential amino acids, right? This is the essential fatty acid. Deficiency in that is unheard of. I can't even think of a situation where I've heard of a case study. I don't know if you have, of somebody being deficient in ALA outside of like eating disorder, obviously. But that's a little different scenario, right? EPA and DHA, they are omega-3 fatty acids. You can convert some ALA into these two fats in your body. It is very, very inefficient. So you're not getting a lot. I wouldn't argue that you can do therapeutic levels of EPA and DHA for, heart health, mental health, anything like that, just from the ALA, right? So that's where eating fish comes in. That's part of why they think the Mediterranean diet is so healthy, right? Is that there's a higher intake of that EPA and that DHA. I mean, there's more that we can talk on that kind of thing. But as far as, I feel like I'm going to get off topic when I say when we're looking at like therapeutic doses of these supplement fats, with the EPA in particular is our biggest body of evidence. We're looking at somewhere around 1,000 milligrams, right? 1 gram of that. And a salmon fillet, like a 3 ounce or so salmon fillet, only has 0.3 grams. So we're well below that therapeutic dose for like the mental health benefits that we want to talk about. And I've also seen research that was interesting to me recently that even the cardiac effects that we think we get from fish oil are needed at that same higher dose. So even for like, cholesterol regulation and stuff like that, we may actually need those higher doses for that like additional therapeutic benefit, I guess. That makes sense.
Interesting. Yeah. And so at this point in time, from your reading of the literature so far, do you think that's because there is no benefit with lower doses, or do you think it's because it's those higher amounts that have
Mm-hmm.
been studied predominantly, and that's just kind of become the set point, so to speak, now?
Yeah, that's a good question. And so it's hard, right?
Yeah.
So I think there's some of both. I think to some extent, like I mentioned that Journal Club article that we were talking about, and like learning stuff that I hadn't known about the research before, there are actually negative studies published on fish oil, which I had never come across before until this article. This was a kind of a compilation of all the data and trying to identify like why there was positive and negative results in the research, right? And so to me, I was like, what do you mean? I've never seen negative, right? And so one of the theories is that in some of the countries that have produced negative results are high fish eating countries, right? So Japan, Mediterranean regions, and things like that. So there is some theory that somebody that already has a fish heavy diet is going to see less of a result because they've already got it. My short-ish answer is that I think it is because those higher doses are more, you need that to skew the ratio between saturated and unsaturated, between, the omega-6s and the omega-3s. You just need that higher dose, especially when you're eating like a standard American diet, right? That leans the other way. I haven't seen a definitive dose on that. Most of the doses that I see researched are like 1,000 milligrams of EPA or 2 grams of just fish oil, right? Just depending on what the study is. So I haven't come across research that compared like 500 milligrams versus 1,000 versus 2,000. I haven't seen any research like that. It may be out there. I haven't come across it.
Yeah. Wow. Needed.
Yeah, there's a lot of room for research.
Gosh, and I feel like there's so many parallels with other nutrients in the same regard, that if baseline nutrient status isn't being tested or,
Absolutely.
intaken, right?
Yeah.
You would expect, as a dietitian, you would expect the results to be different, but it doesn't always translate into study design. So it's a
Yeah.
really, really good point. So
Yeah.
anything else you want to say about the types of omega-3 fatty acids?
I don't think so. I think that covered the basis of it. Those are really the only ones that we really pay much attention to. I'm sure there's some other obscure ones somewhere, but like I said, ALA is the only one that you have to have, right?
Yeah.
So yeah, I don't think there's anything else there.
So a really cool clinical pearl, I can't remember the percentage of conversion off the top of my head, but I've heard and read that women in their childbearing years are able to convert the ALA more effectively to
I
the long
mean,
fatty acids. I think it's maybe like 12% more or something. It's
that's interesting. I hadn't heard that, but I mean, it makes sense, right? Because you need
Yes, our
That's what
body's
builds the nervous system, right? Yeah.
our body's intelligence. But for these really high doses, like the 1 gram per day, so you
Mhm.
mentioned maybe some cardiovascular benefit, but what we're really focusing on here today are the mental health
Right.
benefits.
Right.
So what do we know so far about the mechanisms through which
Oh goodness.
this?
Yeah. So outside of like the official deep dive that I did recently, I am actually putting together a presentation on inflammation and mental health, and it is a wild ride. There's so
That,
much out there to learn and to think about and stuff. The most bare bones way to say it is that depression in particular, but mental illness kind of as a general, is very, very highly believed to be an inflammatory process. So you
Mhm.
see a lot of the same inflammatory markers elevated in like depression as you would see in like cardiac disease or diabetes. Those same the cytokines that we're looking at, right? So I'm drawing a break. My brain's a little dead. Sorry. So the interleukin six
And
and 1,3 betas,
yeah.
the tumor necrosis factor
Hmm.
alpha, we see those elevated in all of those like chronic health, physical health conditions, and then in mental health as well, particularly that IL-6 and the C-reactive protein across the board. Some of the like anxiety and panic and like fear type disorders, you see some of those others a little bit more frequently that you don't see in depression. So like the the 3 beta, I think it is. And then that TNF alpha tends to be more predominantly elevated in those anxiety disorders as well. And so the short answer, I guess, within that is that EPA and DHA are anti-inflammatory. The longer answer is that I think my opinion, the opinion that I'm getting from reading 4 million articles lately is that we tend to think of like the research is like we're looking at cytokine theory, we're looking at blood-brain barrier breakdown, we are looking at the HPA axis activation and different things like that, but it all comes back to there is something inflammatory that works in there. And so I feel like, again, not a researcher, not a doctor or anything like that, but I feel like there's a almost like if you think of like a cycle of potential things that can lead to mental illness, and at some point something breaks down and then it cycles everything else. You get like a spiral, right, going to it. And so once you have something kick off that inflammatory process, they all just kind of make each other worse, if that makes sense. I hope I'm describing that very well. So the anything that you can add into the environment in general that is going to help take down some of that systemic like chronic inflammation, you're going to see some improvement in mental health, right?
Hmm.
There is a researcher group, I cannot think of their name right now, but they have actually proposed that they start considering major depressive disorder as a metabolic disorder type 2, or metabolic syndrome type 2. So because it follows those same inflammatory pathways and markers and things like that. So that's the short answer. The long answer is like, how is it mediating that inflammation, that kind of thing, which we can go down some of it. Some of it, honestly, is like, this is what we think is going on. We haven't actually 100% like, this is for sure what it's doing, right? So you can kind of play around with that. The other thing outside of directly in the brain is that there seems to be more and more research in gut health and fish oil, right? So this EPA and this DHA. We always talk about like fiber, and fiber is fantastic for the gut microbiome. Like I think we've kind of like more than well established that, but newer research is showing that omega-3 fatty acids and polyphenols that you get from some of your fruits and stuff like that are also prebiotic. So kind of moving away from that idea of like fiber is the only thing that we have to worry about or think about, with that. And so when we make the gut happier, that anti-inflammatory effect also communicates back and forth with the brain. So there can be, I think, more than one, honestly, is I doubt we're ever going to find one single mechanism that is like the reason that EPA in particular is so good for mental health,
Yes, yes. Yeah, and you kind of touched on this a little bit, but for those who aren't familiar, there is this gut-brain signaling that occurs, through the vagus nerve, and there's all of these, I think of them as mini nerves, right? All the
Yeah.
apparent nerves are coming off, and there's a whole lot of signaling that's happening from all the.
Absolutely. I encourage anybody that is seeing clients, especially clients that are struggling with mental illness, to read up on polyvagal theory. If you're not interested in that at all, that could be 14 podcasts all on its own. But it is super interesting. And not to say like I am not the one to interview for that, but it is a super interesting concept. But a lot of it is the regulation of like serotonin and dopamine get talked about like all the time, right? Like we know serotonin and dopamine, like we're going to feel better if those are adequate and we're responding to them adequately, right? But within that polyvagal theory, you're looking at some of the catecholamines, so epinephrine, adrenaline, right, norepinephrine, and what those do to your mental health and your stress response and stuff like that. And then, so as much as we like to think of them communicating, if you're the polyvagal theory, like graphics, they do a really good job of showing like the physical things like that are actually happening to your body when you're in those different states. And it's, your insulin resistance goes, or your insulin sensitivity, goes down, your heart rate goes up, your digestive ability goes down. So you are physically limiting your digestion when you're stressed out. When you're stressed out like that, you also don't have as great of a stress response, right? So it's figuring out like where in that cycle and that back and forth, that breakdown is, right? And so that fish oil seems to help mediate almost from like both ends, I guess is a good way to think about it.
Is there some neuroplasticity too that could be occurring? What have you found there?
Yeah, so neuroplasticity, do we need to define that? Do you think? Yeah, so neuroplasticity is super interesting to me. It is this idea that as you increase neuroplasticity, you have a more flexible or ability to have more flexible thought patterns, right? And so I always, I think probably the video that you may have seen me talk about is like if you're in anxiety, right? You're having an anxiety attack or you're just anxious in general, the only outcome that could possibly happen is like the worst outcome you can imagine, right? Like it's just going to be terrible, right? But when you have more neuroplasticity, you have this ability to realize like there's like this whole gray zone in between like nothing and terrible that can happen, right? And so you're able to see things in different ways, which helps you just manage that stress and that anxiety and that fear of like that unknown, right? You do see benefits to like depression as well, right? Outside of food is where most of increasing neuroplasticity, like, what am I trying to say? There are other ways, like food isn't like the biggest way to do it, right? And so that is like looking for novel experiences, and it doesn't have to be major. They talk about like just taking a different route to work, right? Listening to new music, learning new things. So like I always like to tell my clients, like Duolingo. You don't have to plan to be fluent. Just hit up Duolingo. There's a music section. I guess there's like a chess section now. I don't know. There is any kind of new hobby, meeting new people, any kind of novel things. And then there is this compound called BDNF, and this is ultimately the compound that we are increasing that makes that neuroplasticity greater, right? We can get that largely, it's called BDNF, it's brain-derived neurotropic factor, right? And so all of this inflammation that can happen, it's going to drive that down. So now we have a more rigid kind of thought pattern, so to speak, right? So if we do those things to support that, we're going to increase that, but we can also directly increase it with physical activity. So using your muscles actually produce quite a bit of this BDNF, and it does cross the blood-brain barrier. So you can get that into your brain to help with that neuroplasticity in there. As far as nutrients go, fish oil is pretty much all we got to increase as far as we know. I mean, I'm sure, like you said, there's so much more research to be done in this area, but the only thing that we like really have a good solid grasp on that increases neuroplasticity diet-wise or nutrient-wise is fish oil. So you definitely can increase that. And again, it's not just eating a fish fillet a couple times a week. It does take more than just that to do it.
It's so interesting to think of omega-3s working in the background to make it possible for you to think in a way that would help with mental.
Isn't that crazy?
It's incredible.
And it feels so like abstract and like tangible, and like a lot of the research, as much research as I've been reading on anti-inflammatory diets, near every article I've read talks about that BDNF, whether or not they're equating that to omega-3s or not. It is a super important compound that we can be deficient in, for lack of a better word, when we have like mental illness, for sure.
Yeah, so interesting. Okay, so let's think a bit about, kind of some of the specific mental health conditions that there actually is some decent research on, acknowledging that, I mean, new info is being published every day, every week, right?
Yeah.
Mental health. But to date, again, from your reading, what do you feel pretty sure about?
If I was going to be 100% confident, depression and anxiety would, even then 100% is pushing it. By and large, nutrition and mental health in general is like 95% depression. And then they'll go and they'll like also look at anxiety while we're doing this study, right? And so what I think is so cool about fish oil is when you're looking at studies like this, it's like depression improved by this much and anxiety didn't improve at all. So a lot of the like dietary measures, some of the nutrient depletions and stuff that we see that affects depression doesn't unfortunately seem to also affect anxiety, but fish oil does. So that's really interesting. Once you get outside of that, you see less and less research on it, right? So I've been thinking about Journal Club for a long time. And what actually finally made me do it, like, I just going to do it because someone posted on schizophrenia and the keto diet eliminating psychosis or it was something long, I don't remember. It was such a bad study. I was like shocked to see a dietitian had posted it. I was so disappointed. And like, I don't know what her education background or anything like that is. And like, no way am I going to call out who it was or anything like that. But the researchers claimed this was the result. So I can see that impulse of like, and I know this isn't official, but just in general, like this is what the research said in the abstract, this is it. But the study was very poorly designed and also didn't say that like in the results, So I say that to say that the research that we do have published on things outside of depression and anxiety are pretty limited. So with ADHD, from the best that I can tell, they see benefit in people that were tested and show a low baseline of this EPA. I keep saying fish oil, and I use some of these terms intermittently, but we're pretty let's say 80%, that number I made up, but let's say 80% certain that EPA is actually the oil within fish oil that is doing these benefits in the brain for mental health. And so when they test these omega-3, markers, whichever ones they're doing, if they are low, then we get a lot of benefit we get some benefit from it. The only with ADHD that we have seen like any kind of positive effect is those individuals that were found to be low first, right? Adding it to people that had an adequate not intake, but level, we don't really see any statistical or clinical improvement from fish oil and ADHD. That area of research, I think, is lacking, but also it's been talked about so much lately. With some of the like movements that are going on right now, there's a lot of like dyes and gluten-frees and stuff like that. And at last lit review, I didn't find really a whole lot of diet stuff with ADHD in general. Moving on from that, so like schizophrenia, bipolar disorder, like more of those more severe mental illness, if you want to think of it like that, they seem to kind of go the route of depression, especially bipolar disorder. But it's super, super mixed. There's not a consensus as far as I can tell on what it can help. And I don't really see like negative evidence, like this is making it worse, but whether or not it improves seems to be mixed. It seems like in bipolar disorder, fish oil supplementation can help fairly consistently with a depressive phase and not a manic phase. Some research, if you give it super early in the manic phase, it might help with like reducing that severity of it. But there's also some worry because, and it kind of makes sense to me in my head when I think about it quietly, is that if you give it this fish oil in a manic phase, because it does help elevate depression, that it's going to worsen a manic phase. So there is some fear kind of out there that people talk about, but I couldn't actually find any research on that. So that's kind of one of those like, people are worried about it, whether or not that's going to be a thing or not. I personally am not too terribly worried about it, but that is a fear that's like out there and been kind of realized a little bit. Same thing as with ADHD and schizophrenia. When we notice those polyunsaturated fat deficiencies, we can see a reduction in those psychotic features, but also those negative symptoms. I don't know how familiar you are with schizophrenia, but there's 3 different classes of those symptoms, right? And those negative symptoms, for lack of a better way of saying it, are depressive symptoms, right? They are withdrawal from social support. They're, that depression, that, that low mood, that kind of thing. And it seems to help in that. So ultimately, kind of like depressive symptoms in general, it seems to help with the most. Other than those, I can't think off the top of my head that I've read, like in PTSD or in... There's got to be some research out there on autism as well. But off the top of my head, I don't a whole lot know that. I also feel like trying to use these supplements to like fix ASD are not appropriate thought patterns to have anyways,
Yeah, say more about that.
So to me, And when you talk, I think this thought pattern is a lot more prevalent in the autism community, that it's not like an illness that they caught or developed, right? It's like the way that the brain is structured, and trying like to fix it is to change who you are. Kind of like I said, this is a much more thought out process within the autism community. But they don't like the person first language. They are not a person with autism. They are an autistic person. That is who they are. And to say, I'm going to take fish oil or like whatever and like change that's literally changing who they are as a person. And so I think a lot of times with those, like any type of neurodivergence, right, that there needs to be a stronger emphasis on creating an environment that supports that neurodivergence rather than trying to fix it and force that person to work normally within a neurotypical environment, if that makes sense. But that might be a soapbox that I have with me personally. I have done a lot of work to change my environment to address it, so I don't think there's going to be a nutrition thing that makes a huge difference in neurodivergence. But again, not a researcher. That's just, my opinion mostly.
Yeah, and it's interesting when you think about the way that research is conducted. Typically, from what I've seen, like I've been really diving into ADHD recently, and it's often a scoring tool, a symptom scoring tool of some kind that they're using, right? And so, if you're able to achieve an improvement in attention, for example, right? Or a decrease in restlessness, something like that, that's often the type of success measure that you can measure and score, whether it's objective or subjective, right? And so
right.
kind of regardless of someone's level of severity around kind of different conditions or concerns, it's, I think, a really beautiful thing to think, where could there be some improvement with nutrition, right? And it's a difference.
Yeah, I think there's definitely room for it. So like most of what I've seen that have had any kind of positive, and you said you did a deep dive, so you may have seen quite a bit more than me actually, is that that's actually my next deep dive is ADHD. So most of what I've seen is trying to improve the impulsivity that happens with ADHD. And to be fair, I also think that is where someone who is overly impulsive, whether or not that's ADHD or ADHD, is or is not ADHD, is where they're going to have the biggest like life problems from, right? That impulsivity is what makes them more prone to eating disorders. It's what makes them more prone to illegal behavior and to substance use and, things like that, risky behaviors in general, right? And so if you can reduce that even a little bit, sure. I mean, like that's not how my ADHD presents in general. But, of people that I know that have it, if you can just put some type of slowing down to like think through some of that, and you can do that with nutrition, like why not, The other problem with that is like, the research can say one thing, but then getting anybody to do it is different. And then getting somebody that has, an attention span and executive function disorder is 100% a different thing, right? So
yes. Change is hard for, I think, most of us, right? Yeah. Okay. So let's talk a little bit about cautions, because given that there could be some benefit with some of these conditions, if someone were to begin exploring whether it's right for them as an individual or even for a clinician who's listening, whether it's a dietitian or someone else, and they're thinking, maybe I want to start incorporating this more, what do they need to know about the other side of the coin?
Yeah. I want to answer it out of order. Is that okay? My first thought, like as far as like who I would recommend it to first, where I've had actually the most success with my clients is those clients that are like, I know that I have anxiety or I feel depressed, but I'm not going to go see a doctor. I'm not going to take a medication. I'm not going to do this, right? And so those clients I've had pretty good success, and like, let's just try fish oil. Fish oil feels benign, right? It feels like a supplement that people take just because someone said it was good for them, right? Like, like anything else people take for that reason, right? And so I usually tell them in practice, and I actually may change this based on this research, but as of right now, I generally tell people to double the dose of like just whatever over-the-counter fish oil supplement that you buy. So you can get closer to that 1,000 grams of EPA. It's usually about like 800 or so. And what has happened in most of the people that I've kind of like run this experiment with, so to speak, is that they come back and they were, I knew I was anxious before, but like, damn, I didn't realize like how bad it was. I've already got an appointment with a psychiatrist. Like I've had that happen several times. And so when you're looking at research, there is this really cool study, and it's not big. I wish they would do a bigger one, but they compared, I want to tell you, Prozac to like Prozac by itself, fish oil by itself, and that was that 1 gram of EPA, and then Prozac and 1 gram of EPA like together. And the fish oil by itself and the Prozac by itself performed like equally. And then the people that combined it performed even better, right? Like they had more improvement on those like quantifying scales that they use. And so I do like to impress upon people that this is really adjunct care. You can see some of the benefit, but you're going to respond better to your medications and other things when you add this into it. And like I said, I've been able to use it as a like, like you may need to look into this a little bit more, like, and they'll come back and they say, I had no idea like how much this is actually impacting my life. And just like some relief was worth changing their stance on that, which I think is like amazing, especially the first time I had a man respond like that, like being willing, it's so much more difficult. There's so much more stigma on men to speak out about mental health and stuff like that. And the first time I had a man just like, oh my God, I'm doing this right now. And his wife was a therapist and he was still like, no. So it can just be really hard for them. And yeah, like I said, it can be by itself really, really powerful. That being said, like on the flip side of that, anybody that's on anything that thins their blood, I really, really highly caution against doing that without talking to the doctor and the pharmacist first. So that can be medications, right? Warfarin and, some of the other ones that are anticoagulant medications, but also alcohol, some other substance use. If you have a blood clotting disorder or something like that, I would stay away from that. Sometimes in people with GI disorders, sometimes that can exacerbate some of that like diarrhea, discomfort, bloating stuff as that gets broken down. That's usually at higher doses than that like 2-ish grams or whatever of like total DHA and EPA. But the flip side of that argument is that research paper actually had some research that was going as high as 4 grams a day. And like, more power to you if you can tolerate that. You might be seeing some GI discomfort, even in people that don't normally have it, right? So it's those higher doses that you start seeing that in. As far as negative, those are off the top of my head the only like really like caution, stop, that kind of thing on. In theory, fish allergies should not be a problem. It should be purified. How bad is your reaction? How willing are you to risk that,
Sure.
I use sesame seed oil in my food, and my son is allergic to sesame seeds, but he also has like some GI discomfort. He's not getting really, really sick, right? And he doesn't respond. But again, that's a lower risk than somebody that's like anaphylactically allergic to fish, right? So that is kind of like what they're comfort with. Yeah. And in those cases, or in people that just like, I cannot do this burping, the algae oil, another good alternative to that. Yeah. So, and then there's on the other side of, is that another, like a third side, that certain medications like actively deplete your omega-3 baseline, right? And so antipsychotic medications, so it may be that somebody with schizophrenia should be on a fish oil supplement, even if it's not helping their negative symptoms, because again, it's heart healthy. It's, there's other benefits to having that in there. And that's usually maybe some of the more older ones. So that Risperidol, olanzapine, I can't think of the name brand off of that, but the olanzapine, the risperidone, those, I didn't come across Seroquel causing that. That's not, don't quote me on that. The drugs, but the antipsychotic kind of,
I haven't heard of depletion with Seroquel either.
Yeah. What is the name? That's not it. Yeah. I was like, I don't think that's it. I'm sorry, as I get back in over here. And then the Depakote, which I guess technically is an anti-seizure medication, but it's used a lot in psychotic disorders. And then your statins, interestingly enough, even though they may have the same effect, can cause some depletion in that. And then steroids, which, they're both acting on that inflammatory kind of process. So it kind of makes sense that they may kind of compete a little bit. So, but yeah.
And you talked a bit about how challenging it can be to get up to those known therapeutic doses through food.
Mm-hmm.
So let's just talk a little bit about maybe what a food first approach would look like. Mm-hmm. Like, let's develop that a little bit. So if someone's trying to get as close as possible, right?
Do it without that.
And then big picture, how does it fit in with the other types of fats in the diet? Like how does it balance it all?
And I think ultimately, like that's what you're looking at, is where that balance of fat comes in.
Yeah.
And then you're looking at, again, that clinical or research versus like a real person that you're talking to, right? Like there is no way you're going to convince me to track omega-3, omega-6 and saturated. Like I'm just not going to do it. I don't even track my food generally. Like there's no way I'm going to pay that much attention to it, right? And I would never expect my clients to do that, right? That being said, we know that if we can skew more unsaturated and saturated and more, that's not the best way to say that, do a smaller distance, so to speak, between the omega-6 and the omega-3s, that we're going to lean towards that anti-inflammatory, right? So dietarily approach-wise, you know, having fish in your diet is fantastic if you can do it right. You like it, it's not going to kill you, you know, you're not allergic to it, that kind of thing. And some of that is because it's just leaner, right? There's just less fat overall. So you're not going to skew heavily towards saturated fat, right? If that makes sense, like you're just kind of, when you're looking at that balance. So that would be like the same thing, you know, like chicken and turkey and like leaner cuts of red meat and stuff like that, because you're essentially trying to reduce that saturated fat intake from whatever those resources are, right? That topic gets people up in arms on social media, and so I don't want to like give off this idea that like we should eliminate saturated fat. That's not accurate either. We also don't want to give the impression that if we reduce saturated fat, then we're just done with the conversation either, because people are generally going to move towards refined carb sources to replace that energy intake. And that really seems to wash, there's not mental health research that I can find, but cardiac risk, right? That if we replace that unsaturated fat with refined carbs, there's no reduction in cardiac risk in those people. So we have to replace that fat with unsaturated fat, but we don't have to get rid of it completely. And then when we're looking at the omega-3s versus the omega-6s, you know, if we can get into as far as like talking to a person and not to the research, having nuts and seeds every day, right? Having avocados sometimes, olives sometimes, cooking more with those unsaturated, those olives and, you know, it's the olive oil and avocado oils and things like that. And then having that fish on there, you're never going to get to the therapeutic dose. Like that'd be all you would eat all day, would be salmon. And obviously if you do that, you're missing other things that you need, right? But if you're looking at kind of skewing that balance where you want, having that fish in there will help it. Having those nuts and seeds, avocados, all of those other sources of just unsaturated fats in general. And that's usually how I present it to people. I don't usually tell people to have this much polyunsaturated fat and mono, you know, like if you're looking at it, let's just look at unsaturated versus saturated. These are unsaturated, you know, like that, just because, again, you're talking about a person that has way more to think about than what food they're choosing and stuff, right? And also they don't sit and read this stuff all day long either. They don't have the same interest in it as, you know, we do. So yeah. Does that answer your question at all?
Okay. It's bringing a few things to mind. So the idea of a ratio, you brought that up with omega-3 and omega-6s. So
yes,
a little bit.
Oh my goodness. So this is the seed oil argument, right? And so if you get on social media, you know, seed oils are the devil. They're the new saturated fat. They're the evil nutrient. Well, you know, like it was gluten and, you know, like everybody's got to have a nutrient that they've got to like be mad at, right? And so right now it's seed oil. And to an extent, there is some nugget of truth in there, in that seed oil, those omega-6 unsaturated fats, they can take an inflammatory pathway, right? They can also take an anti-inflammatory pathway, and that depends on a lot of other things than just like I chose to use like vegetable oil to cook instead of oil or something like that, right? Like that nuance is really, really low. There is maybe a tendency in our food industry to use more of those. They're just cheaper and they're more neutral in flavor, right? So like if you're using like a really like high quality olive oil, you can taste that, right? Like it's going to throw off the balance. The texture may be a little bit different, but the taste is going to be different, and it's more expensive, right? And so we do, in those types of foods, we do have a tendency towards more of those, right? That being said, if we're leaving food industry out of it, that seed oil itself is not, I would maybe consider it neutral unless we're doing other things to push it more inflammatory. So we are not exercising, we're smoking, we're, you know, high stress and not managing it, and, you know, things like that. I feel like when I was in school, I was trying to remember when I was reading on the fish oil stuff that I think we were taught in like Nutrition 101, like a way long time ago, that we were supposed to look for a 1-to-1 ratio between omega-6s and omega-3s. And that is wild. Like that is really hard to do.
If you calculate that out, yeah, you would have to supplement.
I mean, yeah, like to get to that ratio, right? So I found a study as I was going through this fish oil, like things just kept, again, ADHD, right? Things just kept popping and having questions. And then I would go find this thing to research. And then like, it was amazing that I kept this journal club to like an hour. But I found this study, and I cannot remember if it was in Mexico or if it was on like Mexican, like people of Mexican descent, but they basically took people from the diet that they were had and they moved them into a 5-to-1 ratio. So significantly higher than like what that teacher taught me many years. And I say many years ago, this is my second career. So I was in vet school track at the time. This was like a long time ago. So I may be remembering it wrong too, but for whatever they were at, I want to tell you it was average to 15-to-1, but I might have that number wrong. They moved them into a 5-to-1 through some dietary interventions and through supplementation of fish oil, right? And so they moved them into that 5-to-1 ratio. And like, I hate to say all of them because I also don't believe in absolutes, but vast majority of them saw significant improvement in like cardiovascular risk, I think is the main thing that they were looking at. You know, they always throw in weight in there. So there was some changes in weight a little bit, but not like significantly, right? Because you're just changing the fats out, right?
Yeah, yeah.
So it doesn't have to be that high is the point of it, right? And I think that after reading that article, which by the way, I think I gave you the link so you can like share that to everybody so they're not like, what is she talking about? Yeah. But I think my kind of newer revised thought on it is that we need to be looking at that proportion of that unsaturated maybe, but more so when we're looking at supplementation of fish oil, that ratio. Mm-hmm. And that's also a thought that was one of the conclusions as to why some studies are more positive versus others that may show nothing, is that sometimes one study that was really, really positive had twice the amount of EPA in it as DHA. And that is wildly different from what you're going to find in a supplement, a supplement you pick up at like Walmart or something like that. It's usually actually quite the opposite. It's like 2 to 3 DHA to EPA. So I think some of that ratio is going to play a difference, and we don't know exactly like where that's going to sit or how to do that, or you know what I mean? So I think that's one of those big like things that we eventually figure out, but we're not there yet. But it seems like in general, the EPA at a higher ratio to everything, not a higher like a 3-to-1, but higher in the picture than what it is currently, I guess is a better way to say that.
So are you thinking it would almost look more like the 5-to-1 ratio where it's because it's omega-6 to omega-3, right? So where the one is actually more EPA. Does that make sense? I'm asking that.
No, I think it's from what I was looking at in that was really actually hard to find like definitive research on it other than like consensus like panels and stuff. But it was looking at just straight omega-6s to omega-3s. So that would include EPA, DHA, and that ALA that we talked about, right?
Really? All three of them. Oh,
yeah. So that might actually be another like addition to like honestly like the thought of like thinking about ALA to EPA to DHA. I'm not a numbers person. That sounds miserable. I don't know that that's ever going to be.
Yeah.
I don't think that's ever going to be enough of a difference to get like that granular in it. So, but they've looked at the overall omega-6s to omega-3s.
Yes.
Like I said, I still think in practice, you're talking to a client. You're not talking to a researcher.
You're talking about food. And, I've heard that SMASH acronym a lot. Do you want to talk about that? What is it?
It's salmon, mackerel, anchovy.
Herring is the last. Herring.
I was thinking that other S was something, but I don't, it's just to make it.
Sardines.
Yeah.
Sardines.
So, those are the oily fish, right? Those are the ones that are going to have those highest levels of that EPA in there. Yeah. Or the fish oil, the EPA and the DHA together.
Yeah. So if you're focusing on the foods that provide the really richest, provide the most of the ALA, EPA as a cornerstone in your diet, right? You're shifting your diet in that direction without having to do a lot of tracking, right? It's like my takeaway from you with all of that.
Yeah. So go more towards this way. What I use a lot with clients is, I don't know if you've read the book, The Psychobiotic Revolution.
Yes.
I love that book. I use that even if I'm not talking to somebody about specifically like mental health and nutrition. I use that little psychobiotic food pyramid all the time. It's fairly well balanced and it's actionable. So like we went from, and this is another, I'm going to say soapbox for lack of a better word. We don't communicate very well to public at large, right? And so we went from this fairly unbalanced, not the greatest pyramid like when I was a kid, right? And then they changed it, and then they went to this plate. And I like the plate in theory. It's visual. It looks a little bit more like relatable than like the food pyramid is. But when you're sitting down to eat, like it's not the 1950s anymore, right? We're not eating like, here's my steak and here's my potato, like we don't eat like that. Like per meal basis, right? So we can tell them like, okay, well, maybe this is your whole day ratio, but then they're like, well, crap, when did I have fruit? Like in practice, it looks really good, but in theory, like going throughout, it gets really, even like for my clients with diabetes, they all tell me that they'd prefer the plate method, and none of them come back telling me they like the plate method. They all like, people like I don't like numbers, but carb counting to me is just easier, right? In those situations. That being said, this psychobiotic food pyramid, if you haven't seen it, I literally just like Google it and it'll pull up, and it's the most boring, gray, nothing graphic. Like they just pulled it out of the book. It's so boring. And it doesn't have any nuance because it's a whole book and it's one graphic, right? But it has that balance. It's better balance than that old 90s pyramid, but it also is actionable. And so instead of like lots of fruits and vegetables, it's like a fruit, a vegetable, and a whole grain in that base every meal, every time you eat. I usually tell people, like, let's say if we're looking at whole grains, beans, vegetables, and fruit, pick 2 of those. Every time you eat, you need to have 2 of those 4 is usually how I translate that. And then as you go up, there's those other things, right? And so it's that same balance that we're talking about, right? So we're looking at the meat, it's, chicken and fish more frequently than red meat and like pork and, like that kind of thing. And it's a visual way to kind of talk about how they're portioned out. And then if we need to, we talk about like maybe sometimes nuts and seeds is another layer in that. So you're getting some of those unsaturated fats, but maybe sometimes when we're picking a vegetable, we're picking avocados or we're having olives or, something like that as well as like a little, when it comes up, when it makes sense. Don't like stuff yourself full of avocado if you hate it, but maybe in some situations that's a good spot for mayonnaise, or maybe it is just like really good on a taco and you don't get it that often, right? Or like, whatever that looks like, right? So
yes, they're actually fit,
to
the culinary lens and flavor and enjoyment of and all that too.
And like it doesn't matter like how good an avocado is for you if it makes you want to gag every time you eat it. Like, it's not a good food for you, right? So like that stress is going to like counteract any amount of like benefit you may have gotten from that avocado. Who are you as a person when you're making these choices, right?
My gosh. Yeah, absolutely. No, absolutely. Yeah.
So I feel like that was like the vaguest answer I could have possibly given you, but there's so much of like this nuance of like, what is this person in front of you versus research, right?
Yeah. And I get it. As a dietitian, what we're doing a lot of times is we're seeking to translate the evidence that we're seeing into what are you actually going to choose. And so I think you've done a beautiful job of illustrating that idea.
Thank you. Yeah. It's hard, but I think for like, oh, I'm sorry, I interrupted you. Go ahead.
No, just that the other thing too, that's I think important to mention, like with something like avocados or maybe even certain seafood options is, if someone does not have access, whether because, just geographically or whatever it might be, as dietitians, we really are equipped to be able to help guide individuals towards something else that can take its place, right? There is no perfect way of eating.
Absolutely. And that lends it into like a conversation I have a lot with people is like a dietitian's favorite phrase is like, well, that depends, right? And my clients they know it's coming, like that depends, but it does. It depends on a multitude of things, right? But food security right now is part of it, but also if you're talking to somebody, have they had a history of food trauma, right? Do they have a history of an eating disorder? Do they have a history of only eating when they were at school? Did their parents punish them with food or because of food? Or, and if those things aren't being addressed, man, it doesn't matter how much facts you throw at them, right? Like they need to work through that, and we can help, but they've got to see a therapist. Like they're not going to overcome trauma because you told them that fish oil was good for them, right? Like that other stuff has to make like a lasting change. That stuff has to be. So like we have to work with therapists in conjunction, at least like, hey, I need you to go see, like maybe you could talk to them about this. Oftentimes, because I do market my private practice towards helping with mental health, a lot of my clients are already seeing therapists but it has never occurred to them to talk about food with a therapist, right? And so this giant source of stress that they feel because they are confused, they don't know what to eat, they hear all these things on social media and like, you know, all this kind of stuff, and or they have had an active food trauma in their past and never once thought that like, oh, all this trauma work I'm doing, why am I not also bringing food into this discussion? Why am I not? So oftentimes, like when I say often, like again, this is where I make up a number, right? I'm going to say like 95% because I don't want to say 100%. I have to tell them this needs to be also addressed, like, or the coping mechanisms that you have learned from your therapist, we need to apply to this situation, just depending on what it is, obviously. But I think the biggest red flag, the other piece of that, and I guess it's the same topic, is that if somebody has a definitive answer, that is a big red flag, right? If they know that the only way to do something is the way they want to do it, and I don't mean like the client talking to you, I mean like somebody giving nutrition advice out, then that's a pretty big red flag that maybe they know enough to get in trouble, right? Or to cause like a problem somewhere. But also maybe they don't actually know anything and they're making stuff up, or they have some kind of alternative, like, oh, I know this works because I sell this supplement that has this, you know, like that kind of thing. So if there is an inability to see nuance when they're discussing it, that's a pretty big red flag. So I would, you know, I mean, even honestly for dietitians too, but just for people kind of like learning about health and nutrition and stuff like that. Obviously, I speak in terms of nutrition, but healthcare in general, like if there is no nuance in the conversation, like there's a pretty good indicator that maybe that's not the person that is the best at answering this question that I have, right?
My gosh, yeah. Nutrition, trauma, like food access security, like, you know, these could be podcast episodes after episode, right? So maybe those talk more about here for sure.
Yeah. And then
Go ahead.
oh, I was just gonna say, like talking about that and like food insecurity to an extent, but like if you're talking about like the levels of nutrition needs, like talking about fish oil is really kind of high up there, right? Like it doesn't matter. Like if I give you 2 grams of fish oil every day and you're not eating enough food, that fish oil is not going to help you, right? So like you do have to cover the basics of the things before you start. I mean, I guess you could do both, but skipping all of that to get some fish oil in, you're not going to see the benefit.
Yes. Okay. So to tie this together, using something like the psychobiotic food pyramid, right, as a foundation, because there are all these synergistic effects of food and color and micronutrients with gut health and inflammation and signaling and all kinds of things, oxidative stress with nutrition, you know, moving in that direction with your diet, that's the foundation. And then therapeutic fish oil, ideally, right? It comes
like the sprinkling on top.
But no, that's a fabulous point. That's a fabulous point. Yeah.
So like to bring in like another pyramid, right? That if you've ever heard of like Maslow's hierarchy of needs, if you want to think of nutrition in the same way, right? So there's the psychobiotic food pyramid is really about like overall pattern, right? The hierarchy, like nutrition hierarchy of needs is looking at like, am I eating enough? Way more important than saturated fat versus unsaturated fat. And then like, am I getting enough carbs? People hate that conversation too, right? So you need to kind of move up, and the fish oil conversation's up at the top. Yeah. So I'm not bringing up fish oil to people that are like in the middle of an eating disorder, right? Like this is everything else fairly well balanced, and we're moving towards.
Yeah, figuring out where it fits and for who.
Right. Yeah. Although, like to be fair, sometimes people need to feel objectively like they are being productive and doing something. And, you know, like you can take fish oil pill off a list, right? You can't necessarily check off like the work you're doing in therapy about relationship with food, right? So sometimes, like, again, it depends, right, on the person, but sometimes having that like act thing that they're doing every day just gives enough motivation to like continue to work on everything else, right? So it just
I think there's people probably, you know, do respond differently, and so it always is possible to have that person for whom it really is a game changer, even when overall diet quality is very poor. So I don't want to discount that either.
right.
You know, some increased membrane fluidity, some increased cognitive flexibility with fish oil, even 5-10% more. You know, if it's not harmful in any way,
right,
be okay too, right? That could be
and there is, you know, when you're talking about excess, you know, fish oil is not like the cheapest supplement you're going to find at Walmart, you know, to be fair. Also, like sometimes the burping on a fish oil is cost prohibitive, or is taking it prohibitive, I guess is the way to say it.
Oh, yeah.
There's algae oil and it's the same fat, but like it's also twice the cost, and like
Yeah, they can
I
be.
wish I knew why people don't burp. I have not had a client that I can think of right now that has come back and said they burped algae oil. It doesn't make sense to me. I don't know why. Somebody out there probably does, but nobody's ever like said, "Hey, I know why." So I don't know. But again, it's like it's marketed as like a vegan like alternative, and anytime you slap vegan on there, it's going to double the cost of it, right? And so there is a barrier to a lot of people for that.
Is there anything else you want to say about quality? Supplementation, I think people should look for.
So I know we've been talking about fish oil supplement. I'm actually not a huge supplement person. Fish oil, one of the few, magnesium's another one. So anytime you're talking about supplements, they're not regulated, right? And that's basically the foundation of it. Like you have to make sure you're getting it from a reputable kind of person, right? Company, whatever. Nordic Naturals gets thrown out there a lot as one of them that are really highly regarded. Cheat, I guess is the best way to say that. I don't have time to go and like vet every company out there. I don't have the inclination to do it. I have a full script account as a dispensary, and they have a vetting process to put products onto their platform, and I have just decided to trust them. So I will often tell people like, here's my link, go look for whatever you want and then go price shop, right? Because like, yeah, I do get like a little bit. I have the discount set pretty high because like I don't want that to be like a huge income for me. Like that feels a little like yucky. But sometimes if you buy enough or it's expensive enough, depending on like what they're wanting to buy, like you can get free shipping. But like I've had it go both ways. I had somebody buy a supplement off of FullScript one time and it was cheaper than the exact same one I bought off of Amazon. So I was like, dang it, I didn't even think to buy it myself, So, but that's kind of my vetting process is that they do that whole company that is like kind of their thing, right? Is that they're vetting these companies and making sure they're safe. And I just don't have the capacity to do work that they've already done, whether or not they have the exact same process I would if I could create one.
Sure.
I just can't spend a whole lot of time doing that. That being said, Nordic Naturals is on the FullScript. So
yes, it is. It is. And I know they really have a pretty stellar reputation for purity.
They do. The other caveat with Nordic Naturals, though, not a caveat. Well, yeah, caveat. They sell at Walmart now, which is fine. But you know how like you can buy like a really cheap like more poorly made version of like a lawnmower at Walmart versus what you would get somewhere else. It's the same thing. So it's the quality of it shouldn't be any different, but the dose is significantly less.
Oh, interesting.
So that that Walmart's kind of known for that, or should be known for that. They have a cheaper version of the same product that you might buy somewhere else, right? So like do it, but you may end up having to take like 4 or 5 of those to get to.
Wow.
I don't actually know what the difference.
So compare your labels. Make sure you're checking the amount of milligrams, and if you're paying half as much, but it's a third of the amount, maybe you're not really saving, right? So
yeah. So that would be it. Like I said, I don't imagine that they're putting out like a contaminated product because they're selling it, but it is a lower concentration.
Okay. Good tip. So what are you excited to see more of over the next few years? What kind of research needs to be done? What do we need to learn?
Fish oil specifically. Gosh, like I said, I've so like there's so much like in my brain.
Omega-3s, right?
Yeah. I think that and I guess like it is fish oil specific, but mental health maybe more general, and that like I think we need to know more about the actual like metabolic pathways that are going on, right? So like we have a pretty good idea of like what cytokines are being released, right? These little messengers, or like when cortisol is being released and stuff like that. But like mitochondrial dysfunction and blood-brain barrier breakdown and those kind of things, like we're kind of like, there's like this research paper that kind of thinks maybe this might be an issue. Like I think those kind of things need to be more clarified as either this is a problem or like we thought it was a problem and maybe it's not, like whichever way that goes. But within like the omega-3s and stuff like that, like how are those impacting those metabolic kind of pathways that we're looking at, right? So, we know it's bringing down inflammation. Is it bringing down C-reactive protein, but not TNF-alpha? Like I think some of those things could be really helpful because then we can figure out like why, or maybe even like figure out who we can predict this supplement may help, or this, this intervention, I guess, would help more so, right? I think we need a lot more of that. And then I do honestly, like at the very, very basic of it, we really don't know what dose is like perfect, right? So we do need either have a better idea of that ratio of EPA to DHA or like a specific dose of that. Okay, so we tend to lean towards about a gram of EPA, but does that mean like what my route for the most part has been, well, just double your fish oil dose and you're going to get close to that? That may not be right. Maybe we do need to take fish oil plus an EPA, so we're skewing more towards EPA, right? Like that kind of thing, we really don't have a definitive answer on, So I think a lot of that dosing and ratios and stuff like that may need to be teased out. And then how are we going to translate that into talking to people about, right? But
yeah,
I almost wonder if that wouldn't be more of a product that's specific to that. Like, I can't think of a name. There's a brand that has like a bunch of different supplements kind of put together, and it's a prescription. Man, I wish I could remember the name of it. It's a prescription medication, so to speak, but it's like magnesium and fish oil and stuff like that. So I think we may end up going that route where we know it's regulated, despite what, we hear sometimes about FDA and stuff like that. Like, we know it's regulated, we know it's safe, we know it's not full of mercury, that kind of thing. And by the way, the ratio is good, or, that kind of thing. But I think there's a lot of research for those products to be actually beneficial. Like, you can throw whatever you want in a bottle and say it's beneficial, right? But like, to have like science backing behind it, I think there's just so much more research that needs to go into some of those specifics, right?
Yeah, because when it comes to your mental health and day-to-day functioning, you want to get it right.
Right, exactly. And I always caution, like, as soon as we start getting into this thought pattern that we can use nutrition, whether or not it's fish oil or just nutrition in general, to like treat depression and anxiety, like that, like I would argue that's malpractice. Like, if there is any expectation set that nutrition is going to be the top tier treatment for that, then we're not doing that person any benefit and can actively cause harm, right? So we want to make sure that in our messaging, nutrition is an adjunct, right? Medication, therapy, those are all more important. I can help medication work better. I can help therapy work better. But by myself, I'm not treating depression, right? I'm not treating, if that makes sense at all. So some of our messaging around that, I think we just need to be better. I don't know the answer, but I feel like we need to be better about communicating nuance without making it sound like we don't know anything, right? And I think that we spend a lot of time simplifying things that now it's gone too far, right? And they're just behind, or they're, that kind of thing. And so that balance for like the whole public communication at large, I think we're not doing very good at right now.
Because you're speaking with someone, when you're speaking to the public, you're speaking to all the extremes, right? It's so different than working one-on-one, right? No, you know someone and how they're responding.
I mean, like, to be fair, you have this huge population, and how are you going to communicate in a way that helps everybody and doesn't hurt anybody, right? You can't. Right. And so that's why you simplify it. But when this one piece of information doesn't fix your problem, well, then they just don't know anything, right? Like, I can kind of see the thought process of like losing trust in science communication too.
Sure.
But like, if you talk over everybody's set, you know what I mean? Like, it just gets really, there's a lot of really hairy in there, which is why I tell people, like, if someone's telling you a definitive answer like that, at least needs to get your radar up. Like, well, like, why are you saying thing to me? Like this works for everybody, right? And I think that fish oil will fit in that too.
Yeah. Well, this has been fabulous.
Awesome.
Fabulous. Thank you so much. Great conversation. So I want to be able to close with just kind of any main takeaways. Like, what would you really love for individuals to remember from this conversation?
I think overall, like, if I was to say like one takeaway, is that having a fish oil supplementation does seem to help improve your response to your antidepressants, right? As far as sometimes how quickly even you respond to it, but the like overall, like how well you respond to it as well. And so that it's just another tool in the like overall kind of toolkit, so to speak, of like what your mental health kind of management is, right? So just like your physical health management, you need to have a toolbox for your mental health, and fish oil fits in that. It doesn't replace everything else, right? I think that's my biggest takeaway. Maybe another secondary would be that like we don't have all the answers, and like you may respond at this dose and you may not, and that maybe there's some tweaking. Talk to your dietitian, about it. And then also another one that I kind of touched on, but I think anybody should do with any supplement is make sure your doctor knows what you're taking. Even if you feel embarrassed to be taking a supplement, your doctor and your pharmacist have to know what you're taking, especially if you are on a SSRI and you are taking medication for depression. Fish oil is not going to be a problem, but some of the other supplements that are marketed for depression can be. So just make sure they know everything you're on.
Yeah, safety. Yeah.
Yep.
Yeah, great way to close.
Awesome.
And Jennifer will link, of course, everything that you've shared with me, the research papers that you recommend for individuals to dive into if they have interest and time, and also some of the links to your social media and
do that.
And you.
For sure. I try my hardest to communicate while on LinkedIn. And then my hope, to kind of mirror what you're talking about, is once I decompress from all this research, is that I want to, it'll be more based on like my journal club, like specifically, but having some of those resources up there as well, from what I gleaned from that article and things like that. I did that with my, oh my gosh, the Smiles trial was the first one that we did. And so obviously I speak mostly to dietitians and therapists and stuff, but I don't really necessarily see a huge reason why somebody else couldn't join. We do talk about it more in a therapeutic context, but yeah, definitely. I'll try to have some resources. You put my contact information. I am very slow at putting out content, but it will probably eventually be there.
Very good. Well, thank you for your time. Thanks for your input, Jennifer. And
thank you for having me.
Yes. My pleasure.
Thank you for listening to the Nourished Brain podcast. If today's episode inspired you, I'd love for you to subscribe, leave a review, or share it with someone who could use it. Until next time, stay curious, stay grounded, and stay nourished.